Hello friends, welcome to Creative Medicine. In this lecture, we will learn about hesitation cuts are seen in case of suicide and homicide. Hesitation cuts are tentative or trials. Hesitation cuts are multiple superficial or parallel incised wounds which are seen. These are actually suicidal in nature mainly. They are mainly suicidal in nature. They are most commonly seen on inner aspects of forearm and sides of neck. Incised wounds over the nape of the neck, axilla, and scrotum resemble as lacerations. Okay, so these are mainly suicidal. Mainly suicidal. Thank you and thank you for watching.